In terms of the field of oral medicine, the beauty of it is the variety. And that's what was sold to me when I came in as a trainee many years ago in this program. There is never a dull moment. There is never a routine where everything is the same thing every day. The variety of cases and the scope and the complexity of cases, both from a medical standpoint and from a dental standpoint, is something that you encounter almost on a routine basis during your training here with us. And that's the nature of the specialty.
The oral medicine program, we have residents who have the opportunity to see patients in a lot of different settings. And so we have the hospital setting, the oral medicine residents, they serve as the chief residents for the hospital dentistry service. And so they have the opportunity to see medically complex patients in a hospital setting. The residents get a chance to see unique types of conditions. They may see different types of cancers. They're going to see different types of deep fungal infections. They will get a chance to see other types of lesions and facial pain conditions. Another area is the oral medicine practice. The oral medicine practice is here at Carolina Center for Oral Health, and the residents get a chance to see more of the classic types of oral medicine patients.
Ideal candidate for a resident is somebody who knows what oral medicine is intellectually curious, and is somebody that is open-minded and willing to ask a lot of questions, challenge their teachers and mentors, but also be receptive to feedback. This environment, we really encourage a lot of two-way communication between your faculty members and the residents. Those are the qualities that we're looking for in the ideal candidate.
The type of resident that I think does well here is someone who is willing to try new things. That's one of the strengths of this program.
Being in a large academic medical institution such as Atrium Health is such an advantage for us in that we are the tertiary quaternary care center in the region, and we're right at the forefront of providing primary and quaternary care for patients. And so being side to side with cardiothoracic surgery or the cancer center or the transplant center and even just the general hospital provides the breadth, the depth, the scope, and the collaboration that you can't get everywhere.
The residents have the opportunity to interact not just with the oral medicine faculty and the hospital dentistry faculty, but they get an opportunity to interact with the cardiologist, the oncologist, infectious disease, internal medicine. So any type of specialty is here in the hospital setting. And it's important because the oral medicine residents really are able then to really communicate with different types of specialties and really build up that experience, which is the real strength of this program.
So the oral medicine residency program at Atrium Health provide the best all-around training in both aspects of oral medicine. In addition to that, there is the collegial environment that we provide. They are your peers, they are your mentors, but we like to provide side-by-side guidance to our residents in a collegial fashion. We have a track record, and we do prepare our trainees to engage in a number of different career paths that they choose, whether it be private practice, doing general dentistry, private practice, engaging in oral medicine to become a hospital dentist, or to be a teacher at a dental school.
The type of training that someone receives here really will feel comfortable in all those different types of settings.